Hello everyone. Many pregnant women are concerned about the risk of coronavirus or COVID-19 infection. In this webinar, we will answer some of the questions that have been posed by women with twin or multiple pregnancies. Probably the best guidance, which is updated on a regular basis on the coronavirus infection and pregnancy in the UK, is this guidance, which is published by the Royal College of Obstetrician Gynecologists in collaboration with a number of key national organizations like the Royal College of Midwives, the Royal College of Pediatrics and Child Health, and the Royal College of Anesthetists. This document is mainly for healthcare professionals, but they also have information for pregnant women, which is written in a simple language in a format of questions and answers on this web page, and this is a link. We're gonna divide the questions into three main groups, those related to antenatal care, those related to the birth and the postnatal care. The first question, whether the risk of coronavirus in pregnancy is actually different if you have a twin or multiple pregnancy compared to if you have a singleton or one baby. And the answer to that there is no really evidence that it is different. It's probably the same symptoms and could potentially be the same potential adverse effects, but the data is limited. So what's actually the evidence of or the risk of coronavirus in pregnancy with a singleton or twin or multiple pregnancy? What is important to highlight that pregnant women do not necessarily appear to be at the risk of having a different or more severe disease than non-pregnant individuals. So slightly that the disease would be similar in terms of the symptoms or the potential severity as well. What about the potential risk of complication in pregnancy? Well, there's no evidence that having coronavirus or COVID-19 increased the risk of miscarriage. Until recently, there was no evidence that the virus crosses from the mother to the placenta, across the placenta to the baby. However, a report has been published recently from China that suggests that actually the virus can potentially cross the placenta from the mother to the baby. However, it's important to mention 2 points. Number one, the baby was well, the baby was not harmed. And the second thing is that the data is really limited and we need more cases or more evidence. Reassuringly, there is no evidence that the virus damages the baby or causes abnormalities in development. There is some evidence suggests that these pregnancies have increased risk of preterm or premature births. However, it's not really clear whether this is because women actually just go into labor early, or these women might be unwell, that the obstetricians or the doctors deliver them early. But finally, it's really important that actually we just highlight the fact that we need more evidence. So, and therefore the guidance is based on limited evidence. The next question is that, will I continue to receive specialist care, and what changes could I expect to my care during this pandemic? Many hospitals will continue to provide similar care to what you would have received when you before the pandemic. However, because of the staff sickness, there is a possibility that actually the ultrasound services may be less, or actually that they may be offered in a different place or by maybe slightly different people, so not necessarily by specialist sonographer. Many hospitals have already started doing virtual consultation, so that's telephone or video conference, to minimize or reduce the face-to-face contacts. And therefore, most of the care can be provided virtually without being face-to-face, except obviously the scans. And it's also important to continue monitoring your blood pressure. So some hospitals are offering home blood pressure monitoring. What about if I have a monochorionic pregnancy, so a twin pregnancy that they share one placenta, identical twins, and normally the recommendation, the national guidance is that I have a scan every 2 weeks from 16 weeks until the end of the pregnancy. Would that change during the pandemic? Again, many hospitals continue to see these twin pregnancies every 2 weeks or according to the same frequency as before the endemic, but it's also because of the shortage of the staff that there is a possibility that the frequency of the scan might be less. So perhaps maybe between 16 and 24 weeks, maybe every 2 weeks, and maybe after that less frequent, maybe every 3 to 4 weeks. And as I mentioned earlier, it might be actually provided by different people, maybe in a different venue or by non-specialists. The next question, will actually my antenatal care be affected if I was diagnosed with coronavirus? And again, there's no difference if you have a twin or multiple pregnancy compared to if you have a singleton or one baby. And the general guidance is that obviously if you think you have the symptom, you should contact the midwife or the antenatal clinic and obviously self-isolate, and they most likely will actually postpone your routine antenatal appointments to reduce the risk of transmission. And it's likely that if it is confirmed infection, that the guidance is to offer you ultrasound scan at least 2 weeks after your recovery to make sure the baby is okay. The next question, if I'm pregnant and actually someone in my household, maybe my partner or someone else, had actually been exposed to COVID-19, what should I do? And again, I refer you to the guidance or sort of the questions, the page with the questions and answers that I mentioned to you before. But generally, the guidance is to stay at home or self-isolate for at least 14 days. If you go into labor, you need to call your midwife or your hospital and let them know that you have suspected or confirmed infection. Generally, if you have mild symptoms, advice is to stay at home, particularly if you're early stage in labor. If you need to come to the hospital, generally the advice is to use private transport. When you come to hospital, you will be met by the maternity unit staff at the entrance and be provided by surgical face mask, and will be taken to and will be isolated in a suitable room. You will be offered testing for coronavirus by a swab, and you will be able to have a birth partner throughout your labors, but visitors are generally not allowed. What about if I had the coronavirus and I recover? What the chance? Would I be able, or what's the chance of catching it again? And it is very unlikely, because most of the times you would have produced, or your body would have produced antibodies. However, this virus is still new and the data is limited, and therefore we cannot be 100% certain of that. The next question, what have I have been diagnosed, I had developed a complication in my pregnancy, will my care be affected? And it is important to reassure you that the maternity hospitals will provide safe care to you and to the baby. But as I mentioned earlier, some of the antenatal appointments might be provided virtually, so by telephone or by video conferences to reduce face-to-face contacts. What about if I have a monochorionic twin pregnancy or a twin pregnancy they share one placenta, and I develop a complication like twin-to-twin transfusion syndrome that needs an urgent treatment like laser surgery? Would that be affected or would that be delayed? And the real advice now is not, because this is a dangerous condition and needs urgent treatment, and therefore if you need a laser surgery, it should not be delayed because of the pandemic. What about steroid injections? Is there a risk that could harm the mother of the baby? Well, the steroid injections, we give it usually in case of maybe early delivery, and we give it because to help the lung maturation. And there is no evidence that this steroid injection could harm the pregnant mother, even if you have a COVID-19 infection. And therefore, it's still okay to receive it. The next question, and you've been diagnosed by COVID-19, and what the risk of preterm birth. And as I mentioned earlier, there is data that suggests that the risk of preterm birth or early delivery might be increased in pregnant women with COVID-19 infection, but it is not clear whether this is because women go into early labor or the infection triggers preterm labor, or actually these women are unwell and therefore the doctor or the obstetrician deliver them early. We'll move to the next section, so that's questions related to the birth. If I have COVID-19 when my babies are born, what should I expect? Will I be able to see the babies? Will they automatically have the infection? And again, I refer you to the guidance, and certainly the case, the guidance does not differ if you have a twin or multiple pregnancy compared to if you have a singleton or one baby. So the guidance in the UK is that the babies can stay with you. It is true that in some other countries, the guidance is to separate the baby or the babies from the mother for 14 days. But we know that this could have potential negative effect on the feeding and the bonding, and therefore you balance, you consider the pros and cons of this intervention. The data is limited, and therefore the evidence is changing as the evidence accumulates. It's important that we acknowledge that or reiterate that the babies will be assessed at birth by the baby doctors or the neonatal doctors. They will examine the baby and then they will advise you whether they need testing or not. The next question, what are the risks of home birth versus hospital birth? So it's true that many pregnant women are concerned or worried about coming to the hospital. But certainly in twin and multiple pregnancy, home birth is not recommended, and this advice have not changed or not really affected by the pandemic. Next question is, I'm worried about going to the hospital to give birth. What precautions should I take? And we need to reassure you that all maternity units are doing their best efforts to protect the moms and the babies from the COVID-19 infection, and obviously including or involves wearing the protective equipment and obviously cleaning of the hospital premises. It's important that if you have any symptoms that are suggestive of COVID-19 infection, so that's if you have a temperature or fever, if you have cough, if you have shortness of breath, if you're feeling tired, that you need to let the hospital staff know before you come to the building, and as I mentioned, they will take the necessary precautions. The next question, if I have a cesarean section booked in the next few weeks, and obviously the hospitals are getting busier, should I ask or consider for my cesarean section to take place earlier? And that really depends on the details of your case. Hospitals are getting busier, but maternity units are busy not necessarily because the number of deliveries are increased, but because obviously some of the staff are off sick or self-isolating. The timing of cesarean section is usually a balance, because we don't want to deliver the baby too early because of the risk of prematurity, but also we don't want to leave it too late because that increases the chance that you go into labor and you have to come as an emergency. And therefore this decision takes into account a number of factors, including the availability, obviously, of cesarean section slots in your hospital. The next question I've heard about that the birth partners might not be allowed in the hospital. Is this the case, and why are the restrictions in place, and who will support me if I can't bring my birth partners? And really the answer to this question is that you need to contact your hospital and ask them about their protocol or the guidance, because the guidance is updated regularly. It is true that some hospitals do not allow the partner in theatre, and that, as I said, things are changing. And but certainly most hospitals do not allow visitors or partners after the birth. So most hospitals allow it only during allow the partners to be there during birth. The next question: if my birth partner is allowed to attend once I am established labor, how would I know when I'm actually in established labor? And the answer is actually your midwife or your doctor will let you know when you are in established labor and when your birth partner can be with you. Next question: should my birth partner drop the hospital and then come back when I'm in established labor? Well, I think that's actually a sensible approach because we're trying to minimize unnecessary or non-essential face-to-face contact, and therefore most hospitals allow the partner to be there for the birth. And if you're going for induction of labor or you're not really in established labor, in this case it's better if he can drop you and come back when you are in established labor. Next question: I've been booked in to have my babies early. Is it still safe to do, or should I wait until near to the full term? And as I mentioned earlier, you really need to discuss that with your obstetrician or midwife because it depends on the details of the individual case. The balance or the timing of cesarean section takes into account the risk of prematurity when we deliver the baby early, but also delaying the date of the delivery and the potential risks. We'll move to the next section, which is a postnatal care. So the question is that what postnatal support is available in hospitals at the moment? I'm worried that I will not be able to buy formula as any breastfeeding support available. And again, that depends on your hospital, and therefore you need to discuss it with your midwife or your doctor. It is true that the hospitals are busy, and therefore the postnatal support might vary. But still you should be able to receive the necessary support, and you should still have a safe care. And the next question: will I be able to stay with my babies after birth? And I can refer you to this useful guidance, and the answer is yes. That in the UK, as I mentioned earlier, the recommendation or the guidance is that the baby or the babies can stay with the mother, and as I mentioned earlier, some other countries do recommend separation between the babies and the mom for 14 days. That's not necessarily the case in the UK so far, but acknowledging the limited evidence and acknowledging that the babies will be examined at birth, and the doctors would advise, or the neonatal doctors would advise whether the babies need to be tested or whether they require further investigations. The next question: what will happen if they need neonatal care? So will my partner be allowed to see them and look after them in the neonatal unit? And the answer is yes, within limits, because some neonatal units might want to limit the number of visitors in the neonatal unit to reduce the risk of transmission. What about if you or the partner have symptoms of COVID-19? Will they let you to see them? And the answer is probably not, because obviously we want to reduce the risk of transmission. Will I be able to establish breastfeeding? And the advice or the guidance is yes, breastfeeding is very important. Therefore, there are a number of options. One option is to express the milk, and therefore the babies get their milk, and then when they get better, or when you get better, you can continue breastfeeding. or alternatively is to actually try breastfeed, but obviously have all the necessary precautions to reduce the risk of transmission. And the next question about the home visits or the health visitor visits at home. In the fact that you're worried about the risks, and some hospitals have reduced or stopped the home visits or providing the postnatal care in a different way to reduce the face-to-face contact or for social distancing. But certainly if you have midwife visits at home, they will take the necessary steps or precautions to reduce the risk of infection. Finally, some practical advice or practical questions. What about if do you need to bring additional things to the hospital? Do you need to take additional things to the hospital? Additional food or drinks or cushion or pillow? And yes, it's generally speaking sensible to be prepared, especially with the current situation or the shops are closed, but certainly most hospitals do have the necessary facilities. Do you need to buy things like formula milk or nappies in advance? And it is reasonable to consider ordering things online in case there is a delay in the delivery. And you could check with suppliers whether they anticipate that there should be a shortage. Again, sort of the same things, so was actually to buy additional things, and as I mentioned, it's sensible to be prepared. So I think these are all the questions. We will continue to update things as the guidance or the evidence accumulates, and I hope that you find this webinar useful. Thank you.